Monitoring intracranial pressure. Zero the transducer to atmosphere per your facility's policies and procedures before use. If closed system pressure monitoring and waveforms are desired, the AccuDrain system should be temporarily closed to drainage. Note: reorient stopcock to resume drainage. Draining CSF. In order to drain CSF continuously, turn the external transducer stopcock off to external transducer. Ensure the CSF is draining directly from the patient line to the graduated burette. Caution: proper alignment of the drainage system is critical whenever the system is open to drainage. When open, the height of the drainage system in relationship to the patient affects the amount of CSF drainage and therefore affects intracranial pressure. It is essential that neither the patient nor the drainage system be raised or lowered inadvertently. Whenever the device or patient is moved, the system should be realigned. Height changes should only be made by qualified personnel on the orders of the physician. Collecting and measuring CSF. Accurate determination of fluid accumulation may be accomplished with the graduated burette from 1 ml to 75 ml in 1 ml increments. The burette stopcock should be off to the burette. To drain CSF from the burette into the drainage bag, the stopcock should be off to the sampling site. Ensure stopcock is reoriented to collect CSF in the burette. CSF sampling. In order to minimize the possibility of infection, meningitis, or ventriculitis, the sampling site should be cleaned according to hospital protocol prior to use. Sampling of CSF may be accomplished at the various sampling sites. The needleless site can be accessed with any standard luer-fitting syringe. Access may be accomplished at the patient line stopcock or the Y site immediately distal to the patient's stopcock or beneath the burette. If CSF access is desired from the burette, use the needleless sampling site at the burette stopcock. In addition, CSF may be sampled from the bottom of the drainage bag using a syringe with a 25 or applicable gauge needle according to hospital protocol. Changing the drainage bag. Orient the burette stopcock to temporarily stop flow into the drainage bag. Orient stopcocks to stop drainage of CSF. Lower the burette using the squeeze lock system to allow easy access for the bag change. Using aseptic technique, disconnect the drainage bag from the stopcock, attach tethered blue cap, and detach bag from the system panel. Following hospital protocol, clean the connection site between the burette and the drainage bag. Attach bag to system panel. Connect the sterile replacement drainage bag to drain tube. Turn the external transducer stopcock off to external transducer. Using the squeeze lock system, raise the burette to the pressure level as ordered by the physician. Reorient the burette stopcocks to allow flow from the burette into the drainage bag. Verify flow into the drainage bag.